Welcome, everyone. Thank you for joining us for today's CITI program webinar. In this webinar, Dr. Jeremy Block from Baruch College is going to discuss partnering with technology companies. Now, let me tell you about today's presenter. Jeremy Block is the co-founder of MedAptive Health and an adjunct professor at Baruch College. Previously, Jeremy was a faculty member and IRB chair at Mount Sinai, and prior to that, he worked with the Bush, Obama, and Bloomberg administrations. Jeremy has developed virtual reality and digital health tech and has designed and conducted digital health research at the Memorial Sloan Kettering Cancer Center and MedAptive Health. He has served on multiple academic, private, and corporate IRBs. His human subjects protections interests are focused on the protection of vulnerable populations and situations stemming from his experience as a person who is legally blind, and the design and review of digital health studies.
As always, we want to tell you kind of a little bit about what we're going to do today, what we're going to learn, and lay out our objectives up front. And then hopefully throughout this webinar, I'll do a reasonably good job of aligning it so that these are actually true. We're going to review some of the goals of digital health, the interdisciplinary nature and struggles of working with technology companies and partnering with them when you come from a different background and a bit different training, and identify an overall approach to trying to resolve or address some of the challenges and issues that come up. We'll talk about some best practices for researchers, tech companies, institutions, and IRBs for creating and operating some of these partnerships. And then finally, we're going to explore some of the common challenges that have come up probably in the last 10 to 15 years that different stakeholders face in the research community and the technology companies for the design and conduct of research. With digital health, there's a lot of buzzwords, and because it's an evolving area, whether we're talking about digital health, mHealth, which some people refer to as mobile health, or health IT, which is probably the more traditional term that has been used within the IT and computer science industry, we're really just talking about the same thing, and I'm just going to refer to it as digital health. There are two sort of main goal areas that I wanted to talk about some examples in, just to give people a sense of some of the simple things, at least to describe, not to actually accomplish, that have been going on for some time in the way that people think about the two of the broader categories in digital health. The first is using technology to try to help health behavior change. And there's examples of this: smoking cessation programs, promotion of physical activities with devices, reducing caloric intake, promoting safe sex behaviors, or reduction of alcohol and drug consumption. These are all health behavior kinds of changes that there are technology systems and implementations that people are trying to use to achieve those goals. The other one is disease management. And this can be things that are helping people with medication adherence, asthma or diabetes control for specific kinds of ailments that people experience, psychological support, treatment monitoring for people that are receiving treatments for all variety of diseases and monitoring their status, and then just regular health status monitoring. And you can see how one is really trying to drive behavior change, and the other one is really trying to support disease management, particularly in things that are chronic conditions or serious conditions. And those are just two of the big, broad examples of the variety of things that you'll see in digital health. On the design itself of research, things change. And for me, I find this exciting. New or different types of study design is fun. I like writing them. I like working with people to develop them. It's a happy place. Digital health is creating changes in study design. In the practice of medicine, every single specialty is far down the path now of integrating digital health solutions and tools. And they are for a wide variety of tasks, everything from administrative tasks to actually driving the course of treatment or monitoring and coordinating care and other kinds of things. And that's going to mean you're going to have all kinds of research studies where every specialty is proving or validating a variety of solutions and their utility in the process of them providing care. And that's a great thing. So you're going to see it everywhere. And different specialties have different preferences, and different specialties will have different trajectories. And some may try to address certain problems first and other problems later. So you're going to see a ton of it. And that's kind of that's bread and butter stuff. I consider that really fun, really exciting, and also really straightforward. There is a part of it that is a little more confusing and a lot more fun and a lot more technology driven. And that's where a platform itself, a digital health platform or solution, is the study design. And this is where it's got a lot of stuff going on in it. You can have massive improvements in transaction efficiency, and which means that the research design could change. Something could happen quickly, and multiple follow-ups could be programmed to actually occur on a system. And that's different because you couldn't even do that in person, right? You can't just automatically go from one thing to the next that quickly, but a computer can. The interactions and interventions could be inside an application. And the application could be anywhere. It could be on a mobile device. It could be seamlessly from a mobile device to a desktop, to a tablet, or even to a voice assistant. All of these things, right? The interactions, interventions could be in the technical system. The underlying schema of these systems and the applications can actually directly impact the design of the research study. And so there's going to be a lot of instances where you'll see something and it'll say, this happens in the application. And if you're a reviewer or researcher, you're going to want to push back and say, how? Why? What's the schema? What's under the hood there? And the last piece, and we've seen some of these already, and they're actually really pretty neat, are exploratory applications have a lot of integrations. It could be something like an asthma application that also has data for pollen counts in the local area based on your GPS location that serves up a notification to the individual that says, hey, pollen count's really high today in your area. There's a need for sharing and using it. And to do this better, we have to think through data sharing and data use explicitly. We have to be clear about the data sharing practices between the researchers and their institution and a technology company. We need to respect and understand and express the research norms and expectations around this. We need to follow institutional policy. And we need to make sure that the uses by the researchers and the technology companies are appropriate. How do you do this? Well, it's documentation, and it's found in multiple different places. This is where things get a little confusing. And honestly, this is where mistakes usually happen. We have to have signed, clearly developed agreements, things like business associate agreements, data sharing or use agreements, service agreements with the technology company. And then you also have to make sure that you are reviewing and including in submissions privacy statements and privacy policies from companies, any previous audit results or documentation around that you can review to ensure that you can confirm they don't have problems or critical failures that have occurred, or if they've had problems in the past, they've been addressed. And where appropriate and where necessary, any certifications that people may have, whether it be high trust or others. So all of a sudden, the data sharing is going to include lots of documentation, and different pieces will be in different parts. And so we went through some of the goals of digital health. We talked about the struggle of working together, and we identified an overall approach. We then went through some best practices as it relates to the researchers, the technology companies, the institutions, and the IRBs for creating these partnerships, creating the research, and trying to operate it. And finally, we finished up with some of the challenges that I've seen that people have faced, both on the research side and on the technology company side, for the design and conduct of research and some of the clinical operations of all of it. There's a lot more to all of this. And, there could always go into a deeper dive, but the goal was to really give you this big overall summary and help you identify some of the things you didn't know, so you can start asking those good questions and start working better together in your partnerships.
Please also be sure to visit citiprogram.org to review our content offerings, as we are continually adding new content in various areas of research, ethics, compliance, professional development, and higher education.